Taking good care of your feet is very important for people with type 2 diabetes. Over long periods of time, damage can be caused to the nerves in our feet, and we may not be aware if we start to have an injury, which can lead to an infection, and if untreated, can cause a need for a limb amputation. So with that in mind, there are some things that we want to consider. It is advised to inspect your feet on a daily basis and find care early if you start to get a foot injury. Make sure that your doctor checks your feet at least once per year. And if you have foot problems, you may want to have them check your feet even more often. Some people with nerve damage in their feet have numbness, tingling, or pain, but other people don't have any symptoms at all. They may not know that they have nerve damage. Nerve damage can also lower your ability to feel pain, heat, or cold. Living without pain sounds nice. However, it comes at a high cost because pain is our body's way of telling us that there's something wrong so that you can take care of it. If you don't feel pain in your feet, you may not notice a cut or a blister or a sore or another problem, and small problems can become serious injuries if they're not treated. This list shows several things that you should do to take good care of your feet. You can avoid foot complications if you take care of your diabetes. It's recommended to check your feet every day for red spots, cuts, even swelling or blisters. Being more active can increase the blood flow in your feet and help prevent foot problems. You can also ask your doctor about Medicare coverage for special shoes if you are a recipient of Medicare. Wash your feet every day and dry them carefully, especially between your toes. Fungi and bacteria prefer moist environments, therefore you want to be especially careful between your toes to make sure that it's dry. You can keep your skin soft and smooth by rubbing a thin coat of skin lotion over the tops and bottoms of your feet after you wash them every day. However, because we want the in-betweens of our toes to be dry, you want to avoid putting lotion in between your toes. To trim your toenails, you want to cut them straight across. File the edges with an emery board or a nail file, and if you can't reach your feet, have someone experienced to help you. Always wear shoes and socks to protect your feet. It's important to wear comfortable shoes that fit well and protect your feet, and it's important to protect your feet from heat and cold. They are more sensitive than you might think. A good exercise for foot care can be to wiggle your toes and move your ankles up and down for 5 minutes, 2 to 3 times a day to promote good circulation. This list shows things that you don't want to do for your feet. You don't want to put your feet into hot water without testing it first. Our feet might not be able to tell how hot the water actually is. Similarly, avoid using hot water bottles, heating pads, or electric blankets, as you can burn your feet this way without realizing it. And as mentioned on the previous slide, you don't want to walk barefoot, especially outside. Because we want to keep the blood circulating in our feet, it's a good idea to avoid crossing your legs for long periods of time. Another tip is not to smoke. Smoking can cause further damage to our nerves and make foot problems worse.